Hi, I'm Josh Brewer. I want to go over a 90-90 hip internal rotation movement. So one of the most difficult things when dealing with athletes is many of them struggle even getting into the 90-90 position. So what we're going to do is go over some regressions of the exercise to make sure we can get them in a position where they're activating properly, and then also go through the movement itself and what muscles we want to target and how we can accomplish that through this 90-90 movement. So first off, the body position should always be set by the torso due to how much flexibility they have in the hip. So with this individual's hip on the right side, it's pretty good as far as the movement goes. What we want to do is we want to set a upright position with the back side of the hip. So usually with my athletes, I'll make sure this hip is completely rotated forward, since all we're trying to do is activate the femur moving through that axial rotation, and then we're going to ensure a good tall body. So if the athlete does not possess enough internal rotation or even the ability to get into a 90-90, what we'll do is we'll set them on their left elbow in this position. So he'll go down to his left elbow, and then we can still maintain the same hip position and the same linear path from shoulder all the way through the hip to the knee. Obviously, he can attain a good tall position, so I'm going to set him back upright. And in order to incorporate as much of the rotation as possible, we're going to try to rotate using the ankle as our lead of the movement. So as the hip will rotate internally, the ankle is going to have to raise in order to activate the TFL, which is the internal rotator of the hip. So one thing I normally do is I will always test a passive and an active just by pressuring the TFL with my finger. So right now I can push straight through the muscle as he's inactive, and then as he lifts the ankle, he can consciously contract the TFL, activating that fully. And we understand that if this is fully contracted, we're limiting any compensation factors, usually which occur through the quad, the hamstring, or the calf. So he does a pretty good job. As I find that TFL again, he's going to raise that ankle and he's going to internally rotate. Now, before he gets started with any of the movements, I want to make sure, A, I get him in the proper position, and B, he can consciously contract that muscle. If he can, and then we want to get into the full movement, I'm going to have him irradiate, and by irradiating I mean he's going to contract starting from his core. He's going to make sure everything in his core is compressed and contracted nice and tight, and then everything is going to continue to his hands. So both of his hands are touching the ground. I want to get him contracted all the way through his arms to his fingertips, making sure the contraction of all those muscle groups is as strong, and we're attracting as much contraction and irradiation as possible so it can go through the hip and we get more out of the movement. So once he has everything fully irradiated, he's going to consciously contract and internally rotate by lifting that ankle, and I'm going to have him lift it as high as he can, maximum contraction as hard as he can, and I'm going to limit him to about 15 seconds, and we want to completely fatigue, and once that 15 seconds is over, I'll have him relax. Now, if we went to the opposite direction, and I flipped him facing me and we worked the left hip, as his left hip does not have the same amount, I'll face it. The left hip does not have the same amount of ability as far as flexibility, range of motion, active and passive. I am now going to set him to his elbow on his right elbow. We'll set the position, getting that hip fully forced forward, and then we still have that same linear path. Now in this position, in order to irradiate, if he wants to touch the ground and contract pushing in, he'll have to reach down to the ground in front of his right hip, or he can simply fist up his left arm and punch it straight out in the same direction, where I can test and see how much contraction he's got radiating through the body. So from here, I'll let it up to him which one he feels more comfortable with. he's doing a good job here. I'm still gonna find that TFL right below the hip, and then I'm gonna have him actively, consciously contract. Now, as I felt him lift, there was a slight push and a slight shift away towards the hip flexion. That means he's getting compensation from something else. So I want to back him up, and I'm probably going to give him a little pressure here to increase the difficulty of raising this so I get more of a contraction. So now he's going to push against my hand. Now I'm getting a lot stronger contraction out of there. And once I get that fully contracted, I'm going to let off and continue to have him radiate and push through, drive through, and complete that movement. And we'll relax. So that is how to properly activate and contract in a 90-90 hip internal rotation.